All right, let's talk about something that so many of us experience: dizziness. It can be just weird, disorienting, and honestly, pretty scary sometimes. So today, we're going to get to the bottom of it.
You know that feeling, right? You're just standing there, or maybe you just sat up too fast and boom, the whole room just takes a lurch. It can totally throw you off. Well, that very specific sensation has a name, and really understanding it is the first step toward getting a handle on it.
So we all say dizzy for a lot of things, like feeling lightheaded. But today, we are zeroing in on vertigo. And vertigo is that distinct, false sensation that you, or the world around you, is spinning. When you feel that, it's a huge clue that something's up with your body's balance center, which is called the vestibular system.
So how does that even work? Well, think of your vestibular system as your body's own internal GPS. It's amazing, really. Your brain is constantly getting signals from your eyes, from your inner ears, and even from the nerves in your joints. It puts all that data together to keep you balanced. But when one of those signals goes haywire, that's when you get vertigo.
So, let's dig into that spinning feeling a little more.
To really get it, we need to unpack what causes it. And luckily, doctors have a really clear way of thinking about where it all starts.
It pretty much comes down to two main categories. You've got peripheral vertigo, which is just a fancy way of saying the problem is in your inner ear. And then you have central vertigo, and that means the issue is starting in the brain itself. Now, the vast majority of cases, they fall into that first bucket, inner ear problems. And when we look at the inner ear, there are a few usual suspects. You've got things like infections that cause inflammation, like labyrinthitis, or nerve issues, like vestibular neuritis. But look at that first one on the list, BPPV. That's the one I really want to focus on because it is, by far, the most common reason people experience vertigo. So what on earth is BPPV? Honestly, it's basically a simple mechanical issue. See, inside your inner ear, you have these tiny little crystals. Sometimes they can get knocked loose and end up in a part of the ear where they just don't belong. So when you move your head in a certain way, like rolling over in bed, those loose crystals trigger this short but really intense spinning feeling. Okay, now let's talk about the other category, the central or brain-related causes. Now these are much less common, but they're generally a lot more serious. We're talking about things like migraines, which can absolutely cause vertigo, or much more critical issues like a stroke, tumors, or infections that affect the brain.
And that brings us to what is, without a doubt, the most important part of this whole explainer. Because while most vertigo is harmless, you absolutely have to know when it could be a sign of something life-threatening.
So I really want you to listen closely here. Knowing these signs could truly save a life. If your vertigo shows up with a very specific group of other symptoms, you have to treat it as an emergency, period. If you feel dizzy and you have any of these symptoms, call 911 right away. A sudden killer headache, the worst headache of your life kind. Weakness or numbness on one side of your body. Trouble speaking or making sense of what someone's saying. Or sudden vision changes. These are classic stroke signs, and every second counts. Now there's another level of urgency that's not quite a 911 call, but it's still serious. You need to see a doctor right away if your dizziness comes with chest pain, if you actually faint, if you suddenly lose hearing in one ear, or if you're vomiting so much you can't keep anything down. These could be signs of heart trouble or other major issues that need to be checked out fast. Okay, after that very serious section, let's shift gears and talk about some good news. What can we actually do about all this? How do doctors figure it out and help you find a fix?
The process is actually super logical. Your doctor's going to start just by talking to you, getting your story, finding out what it feels like. Then they'll do a physical exam. And from there, if they need more clues, they might move on to tests, like blood work, maybe check your heart, or even order a brain scan to rule out any of those serious central causes we talked about.
And remember BPPV, the most common cause? The treatment for that is a perfect example of how targeted this can be. It's often a simple, in-office procedure called the Epley maneuver. A doctor or a physical therapist will literally guide your head and body through a series of specific positions to get those little loose crystals to roll back into the right spot. It's wild, and so many people feel relief almost immediately. And for other conditions, the treatments are just as specific. For something like Meniere's disease, it might be about managing your diet and using medication. For an infection, it could be anti-nausea meds and steroids. The main point here is that once you know the why, there's almost always a clear path forward for treatment. So, besides what a doctor can do, what can you do in your day-to-day life? This last part is all about you taking back control. You can actually make a huge difference with some really simple things. First off, safety first. Get rid of tripping hazards, like throw rugs, and maybe add some night lights. Second, manage your stress. Anxiety can definitely make dizziness feel worse. And finally, just basic body care. Drink enough water, eat regular meals, and maybe ease up on the caffeine and alcohol, which can mess with your inner ear.
And if we zoom out to the long term, it's really all about being proactive. Talk to your doctor about your medications. Sometimes dizziness is a side effect. Work on managing any other health issues you have, like blood pressure. And just keep moving. Gentle exercise is one of the best things you can do to keep your body's balance system tuned up.
In the end, it really all comes down to this. Just understanding what's going on with your own body is incredibly powerful. It means you can have a much better conversation with your doctor and really be a partner in getting yourself better. So I'll just leave you with this question to chew on. It doesn't have to be some huge life change. Maybe it's just picking up that one rug, or finally making that doctor's appointment, or even just grabbing an extra glass of water right now. What's one small thing you can do today for better balance? Thanks for tuning in.